So, the most common problems that we see by far, it's diet, okay, and the wrong food. Also, making sure that your bird is in a clean environment is really important. There are household hazards that we have to watch out for, and then making sure that your bird gets proper exercise and bathing. Okay, so a healthy diet. For most birds and most people, the simplest way to form the base of your bird's healthy diet is with pellets. So we recommend, depending on the species of bird, that at least half of your bird's diet be pellets. Now, again, different species require different proportions of pellets. But basically you want that base to be there just to make sure that you've got the grains and the vitamins and the minerals. That's what the pellets cover for you, okay? And Tops, Harrison's, or Rowdy Bush, as you can see there, are the ones that are our preferred recommended brands, okay? Then on top of that, we really want a large proportion of your bird's diet to be veggies, fruit, and things like beans, sprouts, things like that. So avoiding the big three in the United States. Avocado, of course, is highly toxic to birds. Garlic and onion, less so, but if a bird gets a good bite of raw garlic, that will still cause major problems. But 25 to 35% of your bird's diet, and there are classes that CPR offers that are specifically on how to do this part of the diet that are wonderful, and I highly encourage you. Wendy, are you still unmuted? What's the specific name of that course?
It's called Fun with Food Workshop.
Okay.
Yes.
That's a fabulous workshop, and I would highly encourage everybody here to take that. And then, of course, when you're offering the diet, the worst thing that you can do is put it in a bowl and say, here is your food for the day. Because in the wild, of course, birds spend a full third of their day what we call foraging, which is looking for food, okay? And it's fun for them, and it's mentally satisfying, and it actually can oftentimes encourage them to eat foods that otherwise they might not be that enthusiastic about eating, because they've had to work for it a little bit. So the analogy that I give to my clients is, if I was to give you a Christmas present, there are a couple different ways I can do that. I can hand you my unwrapped gift and say, here, Merry Christmas, right? Or whatever, birthday, happy birthday. Or I could wrap it and say, happy birthday, in which case it's a little more fun when it's wrapped, right? You don't know what it is, and it's fun to unwrap it. Or I could hand you a clue, and I could say, you're going on a scavenger hunt, and at the end of your scavenger hunt, you're going to have a birthday present, and you're going to be running all over the house trying to figure out where this birthday present is. And isn't that a lot more fun and stimulating? And so that's foraging for birds. It's not work, it's fun, and it's engaging, and it gets their minds going, and it's something that enhances their quality of life. So that's our goal as far as foraging is concerned, okay? And then, so moving on from diet, so now we're talking about exercise. So, and this is not a photoshopped picture. This is a real picture of a flock of budgies, of wild budgies in Australia, okay? And just giving you an idea of, birds are highly social, some species more than others, and they spend a lot of time flying around and exercising. And so providing your bird the opportunity to exercise, of course, is just as important as exercise is to us. It is to them in keeping them healthy. Okay. And we can talk a little bit about wing trimming, but bottom line is that after your bird is trained and you have a good relationship with your bird, we don't recommend wing trimming unless you have specific situations in your house that are just prove it necessary, because we want your birds to exercise. Okay, so ways you can get your bird to exercise. Encourage wing flapping, stair climbing, and that can either be real stairs, or obviously you can do sort of laddering, climbing towels or ropes, and trick training is so much fun. And there are so many resources out there today online that can really enhance the bond between you and your bird, enhance your bird's brain, and also give your bird some good exercise. Okay. All right. So we've talked about diet a little bit. We've talked about exercise and foraging. Now, hygiene. Hygiene, of course, is super duper important to keeping your parrot healthy. And of course, in the wild, you got to think about it. They are not exposed to their droppings. Okay. When they poop, they scoot their little hiney holes off the nest or outside of the tree trunk, and they poop outside, and then they never see it again. And so we have to make sure that we are keeping their environment super clean in order to prevent molds. Are the main thing that we're worried about. There's a big one called aspergillosis that can grow on bird droppings that then can cause pretty severe illness. So just making sure that you're being fastidious about keeping your birds droppings cleaned up. So we want to change your cage liners every day and remove food before bacteria grows. So we know that a lot of birds love to dunk their food in their water, and that can create a big mess. Bottom line is that birds are one of the messier pets that you could choose, and that a little bit more cleaning is involved if you've got a pet bird, and you may need to change the water dish a couple times a day and provide a bowl and a bottle for them to drink from, so they always have fresh water. And then obviously vacuuming to keep the environment clean. But those are all, I guess, kind of common sense things, but just they're really important. They're more important with birds than they are with mammals, because birds are so sensitive to air quality issues. Okay, so
I can you address about the concerns with potty training your bird?
The concerns with potty training your bird.
I mean, because yes, you can potty train them to poop in one area, but doesn't that, it can make them create some GI issues later on if they only, if you don't get them back to that area.
Right. So similar to, so obviously birds poop way more frequently than human beings do, right? Or dogs or cats. They have to poop every 15 to 20 minutes by Mother Nature's design. They just don't have a whole lot of choice in the matter. So, if you choose to potty train your bird, then you either have to have multiple potty stations. So no matter where in the house the bird is, they have a place to go every 15 to 20 minutes, or you need to give them the ability to move on their own. And of course, the problem with that is if I have a choice between something really interesting going on with my flock or pooping then I may try to hold my poop, and then you end up with problems. So I think, the answer to that is multiple poop stations. Does that answer your question, Wendy?
Yes.
Okay. Yeah. All righty. Yeah. So, so moving on, I will say that this tool, a common kitchen scale that has the ability to weigh in individual grams, is very, very helpful. To me, as a veterinarian, it is one of the most important pieces of data that I can have about my patients, is whether they've gained or lost weight. So I do recommend that you weigh your pet weekly. Please don't weigh your vet. That would be very traumatizing to your vet. But if you notice a 10% change, so if you have a budgie who's 35 grams, then if they lose more than 3.5 grams, that's a problem. If you have a 100-gram cockatiel, if they lose more than 10 grams, if you have 350-gram African gray, if they lose more than 35 grams, then that is a clear sign that we may have a concern and that you need to take your bird to the vet. Okay.
Let's see. There's a question on hygiene. What do you recommend for parasites and mites in enclosures / flight cages?
So nothing.
Nothing. Yep.
For the most part. So mites are really not nearly as big a problem as they used to be. If your bird has mites, then your vet can give you something to treat those mites. And in that case, obviously you have to do major cage disinfection and that sort of thing. But preventing mites is really not something that is an urgent need for most situations, unless you have a situation where you've got a lot of birds coming in and out of the environment. You guys saw in the beginning, I work for Whole Pet Veterinary Hospital, and my whole approach tends to try to be the least chemicals that I can expose any of my patients to, the better, and especially with birds, just because they are more sensitive to so many chemicals. Does that answer the question of the person who had the question? Looks like Sherry.
I believe so, yes.
Okay, all right.
Least is best.
I'd like to know.
Yeah. So, all righty. So, okay, yeah. So, moving on to other daily hygiene things. So, allowing your bird to bathe is an important ritual. Some birds need to bathe more often. Other birds need to bathe less often. It depends on the species of bird and where they're from. Obviously, if your bird is from a more arid environment, then they don't need to bathe as often as a rainforest bird. Okay, so it's important to know a little bit about your pet's natural, what we call natural history, or where your bird lives in the wild and what that environment looks like. But in general, 2 to 3 times a week. Okay, and each bird is an individual, and even in the same species, we see different preferences as far as what each bird prefers for bathing. Some birds love to get misted, other birds love to jump into a puddle and just roll around. And so trying out a couple of different bathing scenarios for your bird and seeing which one he or she prefers, obviously, is preferable to making sure that your bird has the best bathing experience possible. And of course, making sure that your bird doesn't get chilled while he or she is drying off is important as well. And of course, this not only is good for the bird physically, but also in the wild again. So birds spend about a third of their day foraging, we said earlier, and spending time looking for food. And they spend about a third of their day grooming themselves and tending to plumage care. And so the bathing experience allows them to do that in a very natural way and gives them something to do that is productive with their plumage, as opposed to, we see some birds who, when they get very bored, of course, will engage in feather destructive behavior where they are chewing at their own feathers or picking at their own feathers. We all have seen pictures of bald birds, bald pet birds. So trying to avoid that, one of the good ways you can help to avoid that is by giving your bird regular bathing experiences. Okay. I think that's, oh, and then you can, even if your bird is not under the stream of water, using running water to simulate that sound of like a babbling brook or something, turning on the faucet can help to engage them in a bathing experience. Okay.
And sometimes running the vacuum helps too.
Strangely enough. Can't explain it. It doesn't make sense to me, but I guess birds experience that sound as a bathing sound. Yeah. Okay. All right. And we talked about showers as another option. There are suction cup perches that you can put in your shower and you and your bird can bathe together, which is a wonderful flock experience for your bird, and a bonding experience, obviously, for the two of you. Okay. All righty. So moving on from showering now to another grooming experience, which is doing the wing clips, which again, we recommend only in specific situations if it's necessary for your particular housing situation or your particular training situation. But in general, we try to guide people away from wing clips as a everyday thing, because we want your bird to be able to fly, to engage in as many natural behaviors as possible. Nail trimming is something that can be trained over time, gradually building trust, or obviously you can take your bird to the vet or to a bird groomer. If you choose to take your bird somewhere, please, please, please make sure that they are experienced and they know what they are doing, because it is easy to traumatize a bird with a bad wing clip or a bad nail trim. And they will remember if they've had a bad experience, and that can be something that can really give them PTSD and pretty much scar them for life, and that can take a long time to untrain. So at Parrott University, we do have a couple of people there who are very experienced and can do wings and nails for you there. Okay. Just know that with birds, you know, their nails are the same as a human's, as far as there's the part that has the blood supply, which is, you know, up higher and pink, and then there's the part down below that does not have a blood supply or a nerve. My general approach to this is what I say, pinch, pinch, cut. So if you are not using an emery board, if you're using actual clippers, I do recommend that you just lightly pinch the nail twice before you actually cut it. And if your bird reacts when you go pinch, pinch, then don't cut, because that means that you are pinching on the nerve, and that means if you cut, you're going to cut the nerve. Okay. And And we generally do not recommend beak trims except in specific situations where it is medically necessary. I still occasionally have a client come in and say, trim my bird's beak, and I look at the beak and it's fine. And I say, why? And they say, well, aren't you supposed to trim your bird's beak? No, not unless there is a specific medical reason. Okay. But it's just an important part of just daily maintenance to keep those nails. The nails are the main thing. We do see birds who get hung up on things and break legs and that sort of thing. So the nails are super important. Oh, and making sure that your bird has a concrete or pumice perch in the cage to try to help keep those tips worn down naturally as much as possible. And for a lot of the smaller birds, especially budgies and canaries and things like that, that do a lot of hopping from perch to perch, if you line up a couple of those perches in a row so that they can go hop, 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 that can really make a difference as far as their nails are concerned, and can really help lessen the need for you to have to go in and trim or file the nails. Okay.
Yes, we recommend the twister perch, which is a conical type perch. It's not completely round, because we know when they're completely round, it's not good for their feet. So the twister of it has like 5, they get a different position with every stance.
Absolutely, absolutely, and that goes along with basic bird housing. Is you don't, the thing you don't want in your bird's environment is a whole lot of perches that are exactly round and exactly the same diameter, all the same. That can be that can cause pressure sores on your bird's feet. So making sure that you have a variety of different perches in the cage and in the environment outside the cage. Obviously, we hope that your bird is not spending too much time in the cage. So, yeah.
Let's see, Dr. Laura, I have like 4 people with their hand up, so I just want to see if they have other questions.
Yes.
Lily, did you have a question that wasn't answered?
Yeah, that's before. Thank you.
Oh, okay. And Sheila, did you have an answer or question? And then Gabriel, did you guys have your hands up? I just don't want to, or Gabrielle?
Yes, ma'am. I just have a quick question. So me and my husband, we have a cockatiel already. I know this is a little bit off subject, but besides doing like genetic testing or DNA testing, like, is there a way you can tell the sex of our bird? Like, is there a way to?
Cockatiels, yes, you can. Stick around after the meeting and we'll talk about that. Okay.
Sounds good. Thank you. We've been trying to. We've had him for over a year, and nobody can give us like the vet that we bought him from, or the place that we bought him from. Was a pet store, a local pet store, and they said the only way was like genetic testing, so I wasn't sure.
Yeah, we can help you with that, but just hang around afterwards. Okay.
Gotcha. Thank you.
All right, moving on. So we've talked about what you should give your bird and things that how to structure your bird's like home base. Now we're going to talk about things that you shouldn't give your bird, things that can cause problems. And some of these are pretty common sense. Birds, the first thing you should know about birds is that birds are extremely sensitive to air quality issues. We utilize 30% of the air that we breathe. Birds are different. They utilize 90% of that air. They have a very different respiratory tract, which we'll talk about in a minute. But bottom line is that airborne issues are an extremely common source of problems and just very concerning. So don't smoke around your bird. And by the way, if you do smoke and you're outside and you have not washed your hands, you have nicotine on your fingers that can actually be absorbed by your bird's feet. So wash your hands also. No vaping, no candles, no potpourri, no air fresheners, essential oils, fireplaces, gas and natural. Your life is not going to have a lot of flame in it if you are bird owners. When you clean an area, please try to stick with natural cleaners. And if you have to do a heavy duty clean, move your bird somewhere else. And be aware, unfortunately, of new appliances, new carpet. There are aerosolized vapors that come off of these, especially like a new oven. And I apologize for the dog in the background. The oven can actually release toxic fumes the first couple of times that it is used. And so I recommend that you ask your store to turn the oven on and run it for a little while before it gets shipped to you, if possible, or take your bird out, you know, the first couple times you use it. Oh, we got candles. Okay, Teflon. Teflon's still an issue. So you may have heard the expression canary in a coal mine. So that is a real thing that used to happen where miners would go down into these coal mines and they would carry a bird with them. They would carry a canary with them. And the reason for that is that the canaries would die and would start to act woozy and things like that before the humans. And so just another example of how much more sensitive the birds are. So if their canaries started to go wonky, then the miners knew that they had a couple of minutes before they were going to start to experience symptoms as well. Teflon, in specific, when it is heated beyond a certain temperature, releases toxic gases. Those toxic gases are invisible. We can't smell them, and they will kill your bird in a hurry. And I have experienced, unfortunately, a couple of tragedies where I've had clients come in who have lost multiple birds very, very quickly. You know, in specific, I had one client whose daughter went to Goodwill and bought a pan at Goodwill, and the main owner wasn't aware of it, and she lost, you know, I think 4 conures and 2 cockatiels in one fell swoop. So you need to be aware of Teflon, and just I recommend you don't have it in your house. But okay, back to what we were saying. New ovens and stoves can give off fumes. They can release several different types of fumes, and so we recommend that you try to get your stove seasoned before it comes into your house. Do not use the self-cleaning feature, okay? And then again, Teflon. Now, the main purpose of this slide is to let you be aware, nonstick pots and pans. But also think about this, your waffle iron may be coated with Teflon. Your iron may be, your clothing iron may be coated with Teflon. Your curling iron may be coated with Teflon. So electric sandwich maker, the list goes on and on. So just be aware of all of these different sources and make sure that you are guarding against all of them, okay? Any questions before we go on?
Yes, there was a question about, is there another, let me back this up. If they are in a separate room from the kitchen, is it okay to use Teflon, or is that a no-go?
So the incident that I mentioned to you where the 4 conures and 2 cockatiels all passed away, they were not in the kitchen.
Right. They were probably up. So yeah, once it gets into the air filter air of your house, yes. So, and for adoption purposes, there shall be no Teflon in the house as far as cookware, bakeware, things like that, because it's not worth it. Mm-hmm. And alternatives for nonstick cookware, actually, your ceramic is really good. Your copper is good. Mm-hmm. There's a bakeware which I've just noticed it's silicone mm-hmm. over, which is pretty good. But again, it's keeping things under 450, I believe 450, 500 is the safe way to go. Mm-hmm.
Okay. Thank you, Wendy. Sure. Yeah. All righty. So ceiling fan injuries. We still see these occasionally. Just be aware that birds and ceiling fans that are turned on do not mix. They can have obviously all kinds of traumatic injuries. So just be aware of that. Other pets in the house. The next few slides are going to be, you may want to avert your eyes if you are sensitive, because there are a couple of more gruesome pictures in the next couple of slides. But bottom line is that especially cats can cause major issues because they have a certain bacteria in their mouths naturally that can really cause a very severe infection very quickly, and that even if you don't see any marks on your bird at all, if your bird had an encounter with a cat, I would strongly recommend that you take your bird to the vet just for a round of prophylactic antibiotics, because it doesn't have to be a full-on bad puncture to cause problems. Obviously, dogs can also be an issue, we're not so much worried about small bites, but just traumatic issues, because they can obviously really, some dogs are so much bigger than birds. So we just don't recommend that you leave your bird and your dog to interact at all. Just, it's too unpredictable. I guess, yeah, we can see birds that were pulled through, or a wing or a leg or something pulled through the cage, bars, that sort of thing. So just be aware, common sense. All right, a lot of other household hazards to go over quickly. Just keep these things in mind. Leather is treated with toxic dyes. And so you don't want to let your bird chew on treated leather. Open fish tanks, your bird can drown. Lead is often found in these beautiful stained glass fixtures, and so if your bird chews on that, they can get lead poisoning very easily. Obviously, there's a variety of toxic plants. The ASPCA is your best source if you're wondering whether your plant is toxic or not. They have a wonderful online resource, ASPCA, and it does include birds. They have expanded it from cats and dogs to include birds as well. And then again, zippers can have lead, jewelry can have lead and zinc, obviously fireplaces. There are issues with some of the ingredients in crayons, obviously sharp objects, drowning in tubs, and of course, mirrors can pose some of the same hazards as open windows with birds' visual perception, and they can run into them and fly into them and traumatize. Okay. So here's an example of a tea light. Okay. that this parrot chewed on the edges of the tea light, and then if you can see right there, there's little fragments of the metal in this bird's digestive tract, and this is zinc. This bird experienced zinc toxicity, heavy metal toxicity with zinc. So it can show up in all kinds of unusual places. So you just have to be aware that anything that your bird chews should be bird safe. Okay, all right. So, so we've talked about basic husbandry. We've talked about household hazards. We're going to spend a little bit of time talking about just the veterinary experience with birds, and then we're going to go over bird emergencies. Okay, so so birds are different from mammals. They have a different digestive tract. They have, before the bird's food goes into its stomach, it goes into a sort of storage area called the crop right here, which allows a bird to eat a whole lot really fast, store it up, and then fly somewhere safe and digest very slowly. Okay, so the crop is typically right here at the top of the chest or the bottom of the throat. Okay, then they have two stomachs. They have a pre-digest stomach, and then they have a grinding stomach called the proventriculus and the ventriculus, or the grinding stomach is often called the gizzard. And then on the other end, they have one opening that's we typically in common vernacular call their vent. Vets and medical people call it their cloaca. That actually is the exit point for urine, reproductive, I only can think of as excretions, but so eggs and sperm, and then their fecal output as well. So they all three empty out into one area called the cloaca, and then they have all these air sacs. So they have an entirely different respiratory tract than a mammal, and so they are quite different from mammals. And you can see, just looking at the skeleton, look at this huge keel that birds have. This thing that is so bizarre looking, but so wonderful. It's a miraculous piece of Mother Nature's ingenuity. And this is what allows a bird to fly, is all of the big chest muscles that are allowing the wings to move are attached to this huge keel. Okay, so avian vets are different as well. We have had extensive avian education. I recommend that you use a vet that has joined the Association of Avian Veterinarians, or AAV, and you can go to that website and find a list of vets who are a member. That just means that your bird vet has made a commitment to stay abreast of the latest in bird medicine and to make sure that they are knowledgeable about all things birds. So we do recommend that you establish a relationship with a vet early. Okay, so birds are flock animals. They require the flock in general to stay safe from predators. The flock is their safety because there are many eyes looking out for predators all the time, and also because your chances of being the one bird that the predator decides to go for are less if you're in a flock of of 20, 30, or 100 birds. So so they feel safest when they are in a flock, and the flip side to that is that because they live in flocks, the flock is very tuned in to sick birds and will sometimes be what we would consider, I guess, mean or whatever, but it's a survival mechanism, will kick sick birds out of the flock because they don't want to catch what the sick bird has, and because predators tend to hone in on sick birds. So what that means is that birds have evolved to hide their illness because they want to stay in the flock, in the safety of the flock, as long as possible. And once the flock knows that a bird is ill, they're more likely to get kicked out. So, so by the time you see that your bird is ill, it's pretty late in the game, usually. So the general take-home message here is, if your bird is acting ill, don't sit on it for a few days and say, oh, we'll see what happens. Take your bird to the vet sooner rather than later, okay? Let me turn that off. So, and we do recommend annual exams, obviously, also, okay? Need to talk briefly about vaccines, but we'll do that in just a minute. So stress, just as in general, when a bird goes to the vet, obviously that bird may be sick and also is stressed because they're in a new and different environment. So I just want to let you know that one of the things that is normal to expect when you take your bird to the vet is, if your bird is showing any signs of stress, your vet may recommend sedating. And sedating in birds is very different from sedating in mammals. We typically think if a mammal is very sick, you don't want to sedate that mammal, but it's been shown that birds actually are safer when they are sedated than when they're not, because they have such a tremendous stress response that stress response can actually kill them. So, so it's been shown, and there are very, very safe anti-anxiety medications. I say sedated, but basically we're just going to make your bird high, okay? We're not going to make them falling over drunk. We want them to be relaxed. We want them to be able to stand, but we want them to be very happy. And we can do that with drugs that will help to make the experience safer. So just be aware of that is something that is normal to expect, okay? We do recommend microchipping your bird. That is something that, depending on the size of the bird, the situation, we may do with sedation, or we may do with general anesthesia. The chip is very small, the size of a grain of rice, but it is so helpful if your bird ever escapes. And that is something that your veterinarian can do. And people can take off leg bands. A lot of people don't realize leg bands are not traceable back to the owners, but microchips are. Okay. All right. So now getting on to the vaccine question with birds. In general, birds do not require vaccines except for young birds. We do recommend the polyoma vaccine if they are going to be exposed to any other birds. Once they get older, they're not real likely to catch polyoma. Polyoma is a series of 2 vaccines given typically 3 to 4 weeks apart from each other. Okay. So there are some other things that, if you do them now, before your bird is sick, it will make life so much easier when you have one of these emergency situations. And one of them is syringe training your bird. This is pretty easy to do. Ask your vet for a couple of syringes just to practice with. Fill them up with something tasty. And you can start by just showing your bird the syringe and giving them a treat, and then moving the syringe a little closer and giving them a treat. And then they can, just gradually from there move to the point to where they are learning that the syringe brings yummy things, grape juice, apple juice, pear nectar. There's a variety of different juices. You get the idea. And when they learn that syringes are yummy, then it makes it a lot easier when you have to give them medicine. You can give them something yummy, then you can give them their medicine, and then you can give them something yummy again. And most birds will be very cooperative in that situation. So syringe training is super duper helpful. Another thing that is super duper helpful is towel training your bird. Teaching your bird that Mr. Towel is a wonderful cuddly experience rather than something that is a swoop down, I'm going to grab you and manhandle you experience. And you can just do that with gradual exposure to towels. You can make towel tunnels and put treats underneath the towel tunnel, so the bird has to walk through the towel tunnel to get the treats, and then gradually bring that towel so that it is snugly over your bird. There is a wonderful video that you can get that not only teaches syringe training and towel training, but also teaches how to get your bird in and out of the carrier and things like that. That is by Barbara Heidenreich, and you can see the link there. But if you just Google Barbara Heidenreich, it's an old video, I'll tell you, but it still works. The training is sound, and you pay $15 and you've got a year's worth of access online to go back to that video as many times as you need to, or you can buy the DVD, but that's old school, but it comes both ways. But I find that video to be very helpful. Let's see. All right, moving on. We are already at 11 o'clock. I mean, 12, we're already at an hour in. So I'm going to try to speed things up a little bit.
This class goes until 1.
Oh, good. Okay, so we've got time. Thank you. So we're going to cover reading your bird's poop. Okay, so this is weird, but one of the best ways that you can get clues as to your bird's health is to monitor your bird's droppings on a daily basis. And as we mentioned, birds should poop every 15 to 20 minutes. So you're going to get a lot of data points here to look at. And bird droppings are weird. They're different, and we're going to teach you. So there's 3 different parts to the droppings of a bird. Number 1, there's the fecal component, which is, analogous to what we would expect from any other mammal. And that part typically shows up as either green or brown and is often tubular in shape. The first droppings of the morning, it can look like a big plop, but usually later on in the day, you can see that tubular appearance to it. The second part of the droppings is another part that we're familiar with as mammals, and that is the urine component, and that's that very wet portion that sort of forms a halo around the dropping, okay? And then there's the white part, and obviously that's something that mammals don't produce, so that is called urates or uric acid. And this is an adaptation that Mother Nature has made for all egg-laying species. So not only birds do this, but also egg-laying reptiles will do this as well. So this basically allows a bird or a reptile that's developing in the egg to grow and excrete byproducts of growth without contaminating the inside of the egg by making those byproducts a solid form instead of a liquid form. So that's that's kind of Mother Nature's plan for it. But bottom line is you want to be able to distinguish the 3 different portions of your bird's droppings, because changes in each different part of the dropping mean different things. Okay, so we're going to look at 2 other pictures here of normal poops. Okay. These poops have both been sitting for a little while, so the urine part of the poop, of the dropping, has mostly dried up. But you can see the urine part would be sort of a wet halo around the outside of the dropping, and then you've got the fecal component here, and then you've got the white urate or uric acid component here. This is a early morning poop or dropping. This is the first dropping of the day, and so the fecal component of that is going to be much larger, but you've also got the liquid portion. You can kind of see the change in the newspaper color right here, and then of course the urate portion. So when we are looking at bird droppings and the bird has loose fecal portion of the dropping, that is true diarrhea. Okay, if the bird has a lot of increased water portion of the dropping, that's not diarrhea, that's increased urine output. And the scientific term for that is polyuria. And so that means a whole different thing than diarrhea does. So it's important to understand what part of the dropping means what. And we do recommend every single time that you take your bird to the vet that you bring a cage liner paper so that your vet can look at the droppings and just make an assessment for him or herself about what the droppings look like. Okay, so there are some pictures here of some abnormal droppings, and we're just going to kind of briefly go over, you know, what each of these has going on. So we're going to start with this picture here, which you can see does not have a formed fecal component. The fecal component has sort of dissolved and spread out throughout the entire dropping. So this is an example of true diarrhea in a bird. Okay. You can still see the normal fecal portions, but the urine is stained green. This bird has a liver problem. Okay. Here you can see that the fecal component is formed, but it is not really nicely formed. It's just sort of big blops. So this is another example of a GI problem, a diarrhea problem. And also you can see how much dropping there is in each of these. There should be only really one big morning poop like this. So if your bird is having multiple droppings like that, that signals a problem. And then this bird actually has a problem with fat metabolism and is producing a lot of fat in the fecal sample there. Okay. Here we have several examples of birds who have increased urine in their droppings. So you've got a big, huge ring of wet around a little tiny bit of the fecal and the urate portion. So this bird may have diabetes, or this bird may have a kidney issue. This bird has a yellow staining to the urates, and this bird also has a liver problem. Okay, so just some examples of some of the things to watch out for. Can you guys see? I just looked at the chat and saw, can you guys all see the red laser pointer? Is that, I don't know if some people can.
I have a no.
No.
Oh, some people can see it and some people can't. I wonder why.
That's interesting.
That's a concern.
Yeah.
Oh dear. I've been talking about all these pictures and pointing away and nobody knows what I'm pointing at.
Yeah, because I can see the pointer.
Most people cannot see the pointer. There's a few people who can.
Okay.
All right. Well, going back real quickly. So
I can.
Lower left is diarrhea. Okay. Upper left is too much stool and malformed stool, so that is sort of diarrhea, but also probably malabsorption. Upper right is liver disease. Lower right is hypercholesterolemia. And then in this slide, we've got upper right is diabetes or kidney disease. Lower right, diabetes or kidney disease. And left is liver disease. So just an idea of the different parts. Does that answer everybody's question? We have any other questions about poopology, since most people can't see my pointer? I wonder what. We'll have to check into that, Wendy.
Yeah, it's, I've got a comment that says make sure the slides are synced to the presenter. I thought we did that earlier.
I don't know. It appears to be presented to me.
Yeah. Yes. Okay. Well, we'll just. Can you talk about the second slide?
The second slide?
Second slide.
This
one here that she's on, Lily. Oh, if online on the phone, you cannot see the pointer. If online on the computer, we can. Okay, yes, and this slide here that we're on. Okay, yeah, that's the reason your phone does have some limitations. Your online computer is the way to go for these things.
Gotcha. But it looks like most people are on their phones, so we'll need to see if we can do that for future. Just know that these two right pictures are pictures that have too much urine. Okay, the urates are normal. On the bottom one here, I can't really tell if the feces are normal or not, but the urine is excessive. Okay, so. All right, I will try not to rely on the pointer moving forward. All right, so we've talked about monitoring your bird's poop. If you see poop problems, obviously take your bird to the vet, because as we mentioned earlier, birds hide illness, okay, until they can no longer hide it. So always be proactive with your birds. The first sign of issues, please take your bird to the vet. Okay. Your basic first aid kit, that we recommend that you have all of these things in your home, preferably if you've really done a great job of prepping, you've got them in a little box, someplace stored around where your bird usually hangs out. so that you are ready to go in case of emergency. So a towel, because your bird will likely be panicking a little bit if there is a big medical problem, and you will need to wrap your bird to keep it from thrashing around, flapping its wings, hurting itself, and so that you can do what you need to do to help your bird. Gauze, obviously, in case of any sort of wound that needs to be wrapped or covered while you're trying to get your bird to the vet. Paper tape to secure the gauze. I will say paper tape is much preferable to other types of tape, because other types of tape can be very difficult to remove from feathers. So we do recommend the paper tape. Cornstarch. Cornstarch is a very handy tool if your bird is bleeding, either from a blood feather or a broken nail or anything. If you need to try to stop the bleeding in a home environment, pour on the cornstarch, and that is a very helpful tool. It will not hurt your bird to apply cornstarch to a bleeding area. Okay. Pliers and tweezers. This can be helpful if you have not previously removed your bird's band and the band gets caught on something, or if you need the tweezers, can be helpful in managing blood feather issues, and then also, removing things from wounds. Okay, cotton balls and swabs, good for cleaning your bird, for getting blood off so you can see exactly what's going on with a wound. Flashlight or pen light, because you may be working inside a towel, you may be working under a wing. Sometimes it's hard to see what's going on. Being able to see the wound is very helpful. Please, and this goes not just for birds, but for mammals, and frankly for humans as well, don't use peroxide on a wound. Peroxide, yes, will kill bacteria. There is no question about that, but it will also damage the cells of the wound bed, and so that the tissue that has been opened and exposed. Peroxide is very harsh, and it will damage that tissue as well. So we do recommend that you use betadine instead of peroxide to clean and disinfect a small wound, and make sure that it is betadine solution and not betadine scrub. Although most of the time what they sell in stores is the solution, but occasionally you find people who will accidentally buy the scrub. Scrub has soap in it, which obviously can also be irritating to the wound. Okay, so betadine solution, and you can find that at your local drugstore.
Okay, there's a couple of questions.
Yes.
Okay, can you use Hibiclens? Is that Hibiclens?
Yes, you can use Hibiclens the same way you would use betadine. Yes.
Okay. Is that better than betadine? Or
no, I'm maybe a slight edge in some situations, but don't go out of your way to buy Hibiclens instead of betadine, whichever one you can easily get.
Okay, and then there's a question on, would you recommend silver nitrate sticks for minor bleeding or no?
So I think that if you can get your hands on them, that they can be helpful for minor bleeding. The thing you need to know about silver nitrate sticks is they sting like the dickens. They hurt. So I would try cornstarch first. And then if you're not getting anywhere, then you can try the silver nitrate sticks. Okay.
And you can use flour if you don't have cornstarch.
You absolutely can use flour as well. Yeah. Thank you, Wendy. Any other questions before we move on to the rest of the list?
Let's see, not related, but I have my birds in the outdoor aviary during the day. Do I need to worry about any parasites in the dirt or avian flu from wild birds? Yes,
you do. Yeah, there's another whole host of issues that come from outdoor aviaries, and that is a talk that's kind of beyond the scope of what we're going to talk about today, but you can hang around afterwards and I can try to answer that question as well. Yeah.
Perfect. Okay, I think
okay. So moving on, Pedialyte is safe to give to birds orally. If you have a bird who is weak, dehydrated, not eating well, Pedialyte is okay to give your bird to try to rehydrate your bird, especially in cases of diarrhea, can be very helpful. Okay, remember diarrhea is the fecal component is dissolved, so you don't have the little wormy, the brown or green worm thing in the droppings, okay? A syringe, we already talked about syringe training your bird so that you can get medicine into your bird and get the Pedialyte, in this case, into your bird, okay? And then saline or wound wash. Man, I wish more people knew about wound wash. So, so you can buy this at the drugstore. My local Walmart has it. It kind of looks like a can of shaving cream. And basically it is saline under very low pressure. So when you push the plunger, you get a little stream of saline, and that stream is low pressure enough to be safe, that's not going to cause a problem, but high pressure enough that it can dislodge a lot of contamination. It can get stuck on feathers out of the way and anything else that might be in the wound. So it's a really good way to clean a wound. It does not sting. Okay, and I find it very helpful in first aid situations to have just a low pressure saline wash to get that wound cleaned up so I can see what's going on and figure out what I need to do to treat that wound. Okay. Any questions about the first aid kit?
Yeah, there's a question about Pedialyte. How much Pedialyte do you want to be able to get into our birds, and do only Pedialyte or water or Pedialyte available? Not quite sure what. So
it depends. It depends on how dehydrated your bird is, but in general, the rule is 100 milliliters per kilogram. So whatever your bird weighs, you can give 1/10 of that in liquid form by a syringe. So if you're using a syringe to measure, okay, a 100-gram cockatiel, okay, you could give up to 10 mLs per day, okay, per day. So a 100-gram cockatiel gets 10 mLs, a 30-gram budgie gets 3 mLs, and that's on a per day basis. Okay.
Okay, and then should they only be getting Pedialyte at this point, or do Pedialyte and just leave the water in the cage too?
Absolutely, your birds should still have access to water. Pedialyte is something that we reach for with diarrhea, because with diarrhea they are losing a lot of electrolytes. But in a lot of other cases, just plain water is just fine. Okay, so my general rule is to, unless you got diarrhea, to start with water, and then if your bird seems really weak, sometimes the sugar that's in the Pedialyte can be very helpful. So you can always add a little bit of Pedialyte and see if your bird perks up, and if so, then switch over to the Pedialyte. Okay.
Okay, and then there's a question about, can I put silver crystalline nano into her water to kill bacteria?
So there are a number of different products that are on the market to treat the water of birds. Silver is toxic if you give too much of it. There are other products that are sold that are various different acids. You can use apple cider vinegar. Bottom line is, in general, when used according to package directions, most of those products are safe. What I prefer is to change your bird's water often and give your bird a water bottle. And there are specially designed bottles for birds that have a little, instead of just having the ball at the end of the nozzle, they have a little lever that your bird can grab onto, so that your bird always has fresh water available without having to drink the treated stuff. Because I do worry about, number one, it tastes funny and your bird may drink less because it doesn't taste good. And again, from a holistic point of view, we try to avoid as many chemicals as possible. Okay. But when used according to package direction, I'm not going to complain too much. Okay.
Okay. There's a request for you to talk about the heating pad use.
Oh, so heating pads. Anytime your bird is sick, and thank you, because I apparently skipped right over that. Anytime your bird is sick, well, let me back up. Anytime your bird is fluffed, if your bird is fluffed, meaning that their feathers are not slick against their body, their feathers are poofed out and they look bigger than they normally do, that is a sign that your bird is cold. Okay, birds can get chills when they are ill, just like a mammal can. The problem is that birds have a higher metabolism than mammals do. Okay, they run much faster and much hotter than humans do, and therefore it is harder for them to maintain their own body temperature than it is for a mammal. And so when they get sick, they can spend a lot of energy that they need for other things just trying to maintain their own body temperature. We can help them conserve their own energy by keeping them warm. So in general, the way that this usually looks is that you put the heating pad under half of your bird's enclosure. If you have a sick bird, we do recommend that you take your bird out of a large cage and put them in a smaller enclosure so that you can keep a closer eye on your bird, but also so that you can provide that heat. Okay. The reason for under half is that your bird can then choose, do they want to be in the warmer half or do they want to be in the cooler half? Okay. Worst case scenario, you may need, if your bird is quite cold, you may need to, wrap your bird in a towel and put your bird directly on the heating pad. But typically we would just say, put your bird in a small enclosure or a box or something like that. Put the heating pad under half of it and make sure that your bird has easy access to both halves of the enclosure, and then put a towel over the whole thing to try to keep the heat in. Okay, and a lot of just a note, a lot of heating pads these days have a 15-minute auto off feature, and obviously you don't want that. Sunbeam is the brand that we have found that tends to not have that auto off feature, but just read the box and make sure that your heating pad does not turn off after 15 minutes automatically. Okay.
Perfect.
All right.
There was a couple questions that just came up about warmth, temperatures in the house that your birds can endure. Because I guess people up north in that, they have, sometimes their heat goes out. So
Yeah.
they're wondering, what's the lowest temperature in the house for their birds. And another person said that they keep their house at 70 degrees, but their little cockatiel is always fluffing up. Is that normal, or are they just cold?
They're cold. They're cold. You have to remember, most of these birds, if you look at where they're coming from, where their ancestors lived, right? They lived in the tropics. They lived in very warm environments. And that also is part of the reason why birds need 11 to 12 hours of sleep a night, right? Because the closer you get to the equator, the days and the nights are pretty much equally divided, 12-12 all the time, and that's what they evolved. Most of these birds came from areas close to the equator. They came from warm environments, and they came from environments that had a 12-hour night. So keeping your bird, yeah, I mean, in an ideal environment, your bird room is going to be in the 70s, and in the wintertime, that may require some extra effort on your part to make sure that your birds stay warm. If your heat goes out, you're probably going to need to rely on friends or go to a hotel or something like that, because birds can get chilled very easily, and they can get sick very easily from being chilled. In general, temperatures in the 60s are not natural for most of our pet birds. Okay, so in general, 70 is usually my cutoff, but I prefer to be, slightly above that.
Okay, yeah. They do have some optional heaters that you can get. There's one called a sweeter heater. I'll put it in the text, which attaches to the side of the cage. So if you don't want to raise your thermostat, you can at least put an additional heating for your bird. Let's see. There was, we'll just do one more question about, does Pedialyte have sugar, or does it have xylitol in it?
No, it has sugar, because it actually, xylitol is not metabolized by the body and is not an energy source. So, so it has sugar in it. It has dextrose, technically, is what it has in it. Yeah. Okay.
And then there's this, there's a recipe that could possibly use in a pinch. It was water, brown sugar, honey, molasses, half teaspoon salt, and a half teaspoon baking soda.
So you can Google recipes for Pedialyte online, and I would say in general, I recommend staying away from honey if you have a sick bird. The same reason that you should stay away from honey in infants, in human infants, just because there can occasionally be bacteria living in that could cause a problem. So frankly, if it were me, I would stick with one of the recipes that just has table sugar in it. But yes, you can Google, homemade Pedialyte and find recipes pretty easily. Okay.
Okay. There's other questions, but we can go. Please feel free to stay on after the class, and Dr. Laura can answer them. Jason, you said that you did have a question. Is it concerning what we're talking about now? Or is it something that you want to talk about at the end of the class?
Okay. Yeah. We'll move on. And any other questions we can answer later.
Okay.
All right. So, so we've talked about husbandry. We've talked about general the approach to the vet. We've talked about being prepared for emergencies. So now we're going to talk about what things you might encounter with your pet bird that are true emergencies, and these are things that you can start handling at home, but obviously you may need a vet to help you with. So, so in general, just be aware that if your bird is sleeping more than usual, that could be a problem. Obviously, if your bird is fluffed, that could be a problem. If your bird is regurgitating, in other words, if you see a lot of sticky stuff around your bird's face and you see your bird like shake its head and stuff goes flying out of its mouth, that's regurgitation, that's a problem. Obviously, feather destructive behavior is a problem. But we're going to go over some of the more common, that's just general, and we're going to go over some of the more common issues. So probably the single most emergent cause of bleeding in birds is a broken blood feather. So looking at these pictures, for those of you that can see my pointer, if you go directly below the finger, you will see a sort of gray-blue shaft in both of these pictures, and that gray-blue shaft is a baby feather that is growing. So when feathers are first growing, they have a blood supply, okay? And then as they mature, they lose their blood supply. So a blood feather is basically a baby feather that has broken while it still has its blood supply. These can bleed copiously, and of course the other issue is when your bird flaps its wings, that blood splatters everywhere and it looks like Nightmare on Elm Street. So the way that you handle a broken blood feather is that first you're going to take a towel and you're going to gently wrap your bird in the towel, and your bird will not panic because you have done the towel training that we talked about earlier to make sure that your bird is comfortable being wrapped in a towel. You are going to gently take the wing of your bird out of the towel, and you're going to apply some of that cornstarch that you put aside in your bird's first aid kit. And you're going to apply it right to the tip of that blood feather, right where the blood is coming from. And then you are going to take some gauze, or you can take a couple of cotton balls, and you're going to apply direct pressure right over that broken feather, right on top of the cornstarch or the flour, okay? And you're going to wait. And you're going to be bored because you're going to have to wait for like 2 to 3 minutes. So you can sing a little song to your bird and talk soothingly and tell your bird everything's going to be fine. But it's going to need to be a few minutes of waiting before you remove that direct pressure and take a look. And oftentimes, if you haven't used a whole lot of cornstarch, your gauze will be stuck to the area after a clot has formed, and you need to not rip it off because you can restart the bleeding. You need to peel it very slowly and carefully off the area. Oftentimes that's enough, okay? As a last resort, you can pull a blood feather, but that requires a certain technique. If you don't pull it properly, you can just rip it and it ends up bleeding more because now you've broken it closer to the base where the blood supply is even better. And it hurts the bird when you pull the feather. So in general, we recommend, unless it's, the weekend and you can't get to the vet or whatever, we recommend taking your bird to the vet to have the blood feather pulled. But in an emergency situation, you can grab that blood feather at the base, apologize to the bird for what you're about to do because it's going to hurt, and then give a good solid yank. And if you completely remove, if you're successful in completely removing that feather, then the bleeding will stop. Okay. Any questions about, obviously, other wounds? Apply the cornstarch, apply the direct pressure, and take your bird to the vet if it's bleeding from any other kind of wound or vent or anything like that.
And
okay.
You use the cornstarch. You don't put any water in it. Correct. It's just straight out.
Right. Yep. Right. Straight on. The idea is that the blood will provide the moisture.
Moisture. Yes.
Okay.
That's okay. Perfect.
All right. Okay. And you can ice the area as well to try to slow down the bleeding. Okay. Don't put ice directly on it. Take a little baggie of ice and a little washcloth or something like that over the baggie, and then put that on your bird. Okay.
There's a question. What happens if the blood stops and the blood feather never got pulled out, but it stopped bleeding? Is it fine? It's just, yeah.
Yeah, it will actually repair itself. That feather will probably, the feather will continue to grow. It will probably be a disfigured feather. It probably won't look completely normal, but that feather will eventually grow out and become a mature adult feather. Occasionally you will see that the whole thing will just fall out early, and that's okay too. Like it'll molt early.
Okay, and then obviously anything that is pulled will regrow. Yes.
Right. Yes. Yeah, remember that, birds typically replace their plumage about 1/3 of their plumage at a time per molt. So, it may take, and they molt typically every 6 months. So 1.5 years, and they should have a completely new feather set if they are on a good plane of nutrition and molting normally. Okay.
Perfect.
All right. Moving on. Egg binding. Obviously just a concern with female birds. I will share with you that occasionally I do see birds named Mike and George and Leo who come in for egg binding because it is possible for a bird to get egg bound on their very first egg. And the owner may not even be aware that they had a female bird. But basically what you would typically see with an egg-bound bird is that the bird is typically squatting, and in that sort of, that sort of tilt position that birds get as they are defecating or expelling their droppings, the bird will often sort of stay in that position, in that sort of tilted forward position. Oftentimes you can see a bulge near the vent, or as in that right picture, you will see that the vent will sort of pooch out, prolapse out, and you'll see pink tissue. Oftentimes, usually these birds are fluffed, and they just are continuing to strain, and you can kind of see that in their body. Egg binding can be fatal. I do recommend that you do not wait, that you take your bird to the vet. And your bird vet will typically give calcium. Sometimes there are some other injections that we can give to help pass, Worst case scenario, we can anesthetize your bird and remove the egg under anesthesia. Okay. But this is something that what you can do at home if you absolutely can't get to the vet is warm compresses. So take a washcloth, run it under hot water, squeeze it out, and then apply it to the rear end of your bird to just help relax that area. Sometimes that can help open things up a little bit so that the egg has a little better chance of passing. It doesn't work often, but if you've got no other option, then that can be helpful. But this is usually a veterinarian's situation rather than something you can manage at home. Okay. And occasionally we do see cloacal prolapse for other reasons. Remember that I mentioned earlier that there are 3 different systems that all empty out into that vent area. The reproductive system is one, which obviously involves the egg, but also the digestive system and the urinary system also dump out into that common area. So when we see a prolapse, it can be reproductive prolapse, but it can also be something going on with the digestive tract or the urinary tract. So if you see any kind of pink bulge coming out of your bird's vent, please bring them into the vet. Okay. Any questions about egg binding?
Nope.
Okay. All right. Difficulty breathing. So this is a video of a bird. Hopefully everybody can see the video. I'm going to play it now. Can you guys all see the video?
Let's see.
Playing it again.
There we go.
I'm not able to see the, oh, wait a minute.
Yes.
Okay, good. So this bird is doing a couple of classic things that we see with birds who are dealing with a respiratory emergency. Okay, number 1, you can see that the bird's mouth is open. This little budgie is panting with the mouth open. And then the other cardinal sign is if you watch this budgie's tail, you can see that he's doing what's called a tail bob, which is with every breath, that tail is moving back and forth. And a tail bob is just a sign that the bird is having to put increased effort into each breath. He's having to breathe really hard to get that air in. This budgie actually had heart disease and was experiencing difficulty breathing because of the heart disease. And he responded very well to heart medication. So there are other causes. Birds can also obviously pant if they get very stressed. And they're very fearful, and they can pant if they're very hot. But if your bird is not, if there's no obvious reason for your bird to be showing you these signs, then obviously if you see this tail bobbing, open mouth breathing, please get your bird to the vet right away. Okay. All right. Any other questions about respiratory issues? Okay. Not eating or drinking. So this one can be tricky. So this is a picture of a bird who is being tube fed. Okay. Birds are very amenable to tube feeding just because when they are babies, their parents will kind of do a version of tube feeding where they will pop the food right down into the crop of a baby bird. And so tube feeding is actually not as stressful as it looks. for birds, but whether it's sometimes difficult to tell if your bird is eating because birds will fake eat when they are sick because of what we mentioned earlier about birds not wanting to get kicked out of the flock. So birds hide their illnesses. So birds will often fake eat. So one of the best ways to tell if your bird is actually eating or not is, again, to look at your bird's droppings. Okay, a bird who is not eating is not going to be producing fecal material. And so your bird's droppings will show the urine portion, the liquid portion. It will show the white urate or uric acid portion, but it will not show the little tubular shaped fecal portion, okay? Or it will not show as much feces. So if you see decreased eating in your bird, obviously that's a sign something's wrong. Or if you see that your bird still is looking like it's eating, but all of a sudden you're not seeing any fecal portion in droppings, that's a sign that your bird may be hiding an illness. Okay, and so birds, as I mentioned before, super high metabolism, super high. They can lose weight really quickly, and they can starve to death in 2 to 3 days of not eating. So again, don't wait. Sick birds need emergency care, okay? And your vet can tube feed your bird to keep your bird going while we're trying to work out what's going on and what the underlying cause of the problem is, okay? And then we just mentioned a bird who is on the bottom of the cage is a very sick bird. I will share with you that birds who are sick enough to be on the bottom of the cage have a poor prognosis. And I will be upfront with my clients and will tell them, you know, I am very worried about your bird and you need to be aware that your bird is very, very ill. The chances of us being able to fix your bird in this situation are lower. Because a bird who's at the bottom of the cage is basically the equivalent of a bird who's on the ground in the wild. And you know that a bird who's on the ground in the wild is a sitting duck for predators. And so we do obviously take that very, very seriously. This is just a bird who's debilitated, and being at the bottom of the cage is a very non-specific sign. I don't know what's going on with that bird. It could be heart disease, it could be liver disease, it could be an infection, it could be any number of other things, but it's just a sign that that bird's pretty ill. So these birds need heat support and they need to get to the vet right away. Okay, so that heating pad becomes super important. Okay. Okay, so this is a generalized slide of multiple other emergencies. So this little budgie is not being cute and inspecting something. This budgie was walking around in this position with his head tilted to the side like this. So if you look carefully in the bottom right of that picture, you can see that the droppings of this little budgie are diarrhea and bright red. This bird had lead toxicity. This bird had eaten some lead-containing metal and needed emergency lead chelation. Other causes of neurologic signs of like walking around with a head tilt, besides metal exposure, and remember lead and zinc are the two main ones that we worry about, are obviously head trauma, okay? And birds can get seizures, and the seizures can be due to calcium issues or infections or other things. And again, we mentioned earlier, if you get an altercation with a dog or a cat, even if you don't see any marks on your bird, I still, especially with cats, recommend that you bring them in. And then if they lose a whole lot of feathers, obviously some birds will pluck and will pull out their feathers or chew their own feathers. But if they lose a whole lot of feathers, that's a big deal. Okay. And I just saw something in the notes about a client having a difficult time finding an avian vet. I feel ya. And with coronavirus and a lot of the changes that have recently occurred in the veterinary community in general, even dogs and cats are having to wait sometimes 6 or even 8 hours to get in as an emergency. We have had emergency vets contact us and tell us, we're full, we can't take anybody else, we're just at capacity. And it is heartbreaking, and there is no easy solution. I feel ya, and you know, I would say read up as much as you can. This class, unfortunately, is beyond the scope of this class to be able to give a lot of detail about what to do in a lot of different situations. But it can be heartbreaking. Sometimes going through your local vet, you have a better chance of getting in at an emergency vet because they can pull some strings for you. But just make sure that you have a good relationship with your local bird vet and know exactly where to go in the case of an emergency so that you don't waste a lot of time trying to call around. Your local vet can sometimes pull strings for you to get in with an emergency, okay? It's frustrating, and sometimes there is no good solution, and we are, as vets, pulling our hair out sometimes trying to get our patients in for care. It's just the state of veterinary medicine right now. There aren't enough vets, is what it amounts to, and there's not enough vet staff, the vet techs. There's just not enough staff. But I think that's unfortunately, that's a nationwide problem in multiple industries. So, back to the slides. How do you get your bird to the vet? Grab that cage paper and cover your bird. If you've got a sleeping cage for your bird, oftentimes that works great, doubling as a transport cage. If you've thought ahead and you've prepared for vet visits ahead of time, you will have a nice transport cage that has a perch in it, that's a small cage. Otherwise, cardboard box, okay? Preheat or pre-cool your car. Emphasis more on the preheating. You don't want your bird to get cold. And grab every medication that your bird is on and go to the vet. So main take-home point here is don't try to hold your bird as you're driving. Make sure it's in a carrier. You need to pay attention to the road, and holding your bird when you're trying to multitask is not a good idea, okay? Keep it warm, put it in a dark box, and cover your box and get to the vet or carrier, okay? 78 to 82 degrees. If you're in shock, you may need warmer than that. If you're in heat stroke, if you've got a bird who's overheated, obviously you're not worried about heat. But I think it's pretty easy to guess when your bird's in heat stroke, because there aren't many situations where you would have a bird in a super hot area. But put towels on the bottom of the carrier, jar lids with food and water, and I guess if you're having to drive a long distance, but I don't know that I would worry about that unless you're going to be traveling a ways. So no vet available. Unfortunately, this does happen. What do you do then? If you do not have a vet available, again, keep them warm, keep them hydrated, and we talked about syringing some Pedialyte in. If you see that your bird's not eating or drinking, warmth and hydration and syringe feeding a little bit of food if your bird will take it. Okay, those 3 things until you can get to the vet. Okay. So I'm sorry, initially with the food and the water on jar lids, I was thinking that was if you were transporting the bird, but if you're in a home environment, yes, you need food and water on the bottom of the cage where the bird can easily get to it. Okay, don't assume your bird's going to climb up to get food or water, because they won't. Okay. Did I make myself clear? I'm sorry, I sort of was talking 2 different situations.
Yeah.
Okay, all right. Any other questions about this? Okay. All right. So there are the good news is there are not many infectious diseases that we have to deal with in birds, contagious diseases, okay, that can be passed from bird to bird. There are a few. The pet industry, by and large, has done a good job of controlling all of them. Remember that birds will mask illness, so a new bird may be acting healthy, but we still recommend a 30-day quarantine if you purchase a new bird before you introduce that bird to the rest of the flock. Okay, so 30 days in their own room. Okay, and making sure that you are disinfecting yourself when you go from bird to bird, just because there are still contagious diseases that can be passed. Okay, and then after 30 days, if the bird still appears to be perfectly healthy, then you can introduce them to the rest of the flock. There are contagious diseases that can be passed from birds to people. The main one that we worry about is something called psittacosis. With psittacosis, one of the main ways of transmission is kissing your bird. Don't kiss your bird for multiple reasons. Number 1, there can be disease transmission, and number 2, that's a sexual or mating behavior when birds mouth feed for each other. That is a courtship behavior, and you do not want to establish a mate relationship with your bird in your bird's mind. That can cause all kinds of behavioral problems. You want to be another member of the flock, but not your bird's mate. Okay, so don't kiss your bird. Yeah, so zoonotic disease is a disease transmitted from humans to birds or from birds to humans. And, you know, just general good sanitation. And again, psittacosis is the main one, and we do test for that in all birds that are in boarding situations, because it can also be transmitted easily from bird to bird. Okay. And there are people who have become very ill from psittacosis. So, you know, it is a real thing, although thankfully not as common as it used to be. As far as coronavirus goes, coronavirus is at this point still not considered a zoonotic disease. So it is very difficult for humans to pass it to birds or from birds to pass it to humans. They have their own coronavirus, but thankfully there's enough genetic differences between humans and birds that it's not a big deal. You know, there are viruses evolving all the time, and I can't say that it's impossible, but it's extremely rare to have a problem with a bird getting coronavirus from a human or passing coronavirus to a human. Okay.
Dr. Laura, could you talk about the procedure to test the bird for psittacosis?
Yes, so the good news is that a test for psittacosis is typically a swab test, and we can draw blood, but usually you would take your bird to the vet and your vet would swab the, typically the way that I've always done it, I think most people do it, is they swab the conjunctiva of the eye, then they swab the roof of your bird's mouth, and then they swab your bird's vent. So, and then send that swab off to the lab for testing. So, so it's a relatively easy test for birds. Typically we get results back within just a few days. Okay. All righty. Okay. Any other questions?
Yes, there was one about transferring, let me find it here, cats and dogs. If they have cats, should they be concerned about transferring any of the diseases or parasites mentioned before handling?
So as long as we're not talking about your bird and your cat coming in contact with each other, which obviously we don't recommend, there are very rare cases, but in general, no. I don't have any concerns about any parasites that are easily transmitted from one to the, I mean, just good common sense sanitation and you'll be fine. You don't have to worry about it. Okay. You know, don't let your cat get exposed to large amounts of bird droppings. Don't let your bird get exposed to, you know, cat droppings, and you're fine. Okay.
Okay. All right. That's it.
Okay. All righty. So one last mention. If the worst happens and your bird passes away, I'm sorry to end on this note, but you may want to consider, if you have other birds in the household or if you're considering getting another bird in the household, having an autopsy done on your bird. In birds, it's called a necropsy rather than an autopsy, but it's you know, the same thing. It's trying to determine the cause of your bird's death. And that can obviously be helpful if we're concerned about diseases that are transmissible, but also sometimes just gives owners peace of mind that they've done everything that they could for their pet. Okay, and that is something that your veterinarian can help you with. Okay.
Okay.
All righty. And I think that concludes our talk. So we talked about hazards in the home. We talked about observing your bird carefully and that birds can hide illnesses and things to watch for with your bird's poop. The importance of good sanitation, good diet, good exercise, and of course, we recommend a yearly exam with your vet. All righty.
You want them to?
I'm sorry, Susan, can you repeat your question?
Oh, I was typing it now. But
oh, okay.
Well, you can just speak. You don't have to type at this point.
Okay. Okay. What are you doing? Yeah. Stop. Come here.
Yeah.
Come here. My Amazon about 20 years ago started playing with my keys. Like they would fall out of my purse or something, or he'd go and get them. So I made him his own set of keys. It's his favorite floor toy. We throw them to each other. He brings them to me. I throw them. Like it's a bonding experience for us.
Mhm.
I guess my concern is the metals that are involved in. Excuse me.
Bless you.
Keys.
Bless you.
You know, I just went over to Home Depot and got old keys that they were going to throw out. Should that be a concern for lead or anything like that? And again, he's 32, so he's been playing with them for a long time,
Right.
and he's okay.
Mm-hmm.
But
So in general, most modern keys, no, are not a concern. I would be worried about old keys, but in general, most modern keys are not a concern. Although, obviously, if you're seeing chunks being removed, that's a different story. Okay, but just mouthing the keys, you should be okay. Okay.
Good.
All right.
Thank you.
Yeah. Next question.
Okay, there was, if you could go back and talk about the aviaries.
Oh yeah, the outdoor aviaries. So there's limits to how safe you can make your birds in outdoor aviaries, because of course wild birds can fly and sit on top of the aviary and poop into the aviary. So your best bet is to use some sort of fine mesh over the top of your aviary, just on the roof, which of course then becomes a pain because leaves and stuff get accumulated up there. But at least that will block the wild bird droppings from coming into your aviary and exposing your pet birds to whatever the droppings from the wild birds. And then, of course, there's predators, and there's only so much you can do. Obviously, you know, making sure that you sink the sides of the aviary deep into the ground, because there are lots of burrowing predators who will dig under. You know, a common problem that we have in North Carolina is with raccoons. Obviously, we don't have a whole lot of outdoor aviaries in North Carolina, but we see it all the time with chickens. And the hallmark with a raccoon problem is a decapitated bird, because they will reach in with their hand and grab the bird and then try to pull the bird through, but you know, they can only pull part of the bird through the wire. So so just trying to make sure that all the perches are you know, a raccoon arm's length into the aviary, so that the bird isn't perching right next to the outer walls of the aviary, is important. You need your birds to be perching away from the edges of the aviary if possible, and that will also help with contagious disease spread. But yes, I mean, there are, and then there's the mosquito issue, right? And, you know, West Nile and other diseases that can be transmitted through insect vectors. And, you know, there's only so much you can do to control mosquito exposure in an outdoor aviary as well. So, but now, having said all of that, I will also acknowledge that in general, sunlight, really helpful for birds. Aviaries are generally large, so there's lots of exercise that these birds are getting in these outdoor aviaries. And in general, it's a lot of birds in an aviary, so you have good socialization, which is also really important. So there are some benefits, obviously, to outdoor aviaries, and I'm not trying to say that I think that they're a bad idea. I'm just saying properly constructed, they need to block wild bird poop from getting in, and they need to encourage the birds to perch far enough away from the edges that you don't have to worry about too much exposure from the sides, either from predators or wild birds. Okay. Any other?
Yeah, there was a question about, and I get this a lot too, about artificial lighting. I think I'm trying to look back up into the chats.
So some species of parrots evolved to live on treetops and to get a lot of sun exposure. And other species of parrots evolved to live down inside the canopy where there's not as much light. And our treetop species do require more ultraviolet light in order to really have optimum health. And so some of these species, African grays certainly are one of them that are, like the poster child for this, do benefit from a low level UVB specific light. Now, I will also tell you that there are certainly a lot of light bulbs that make claims about having a good spectrum that don't live up to it. So, in general, ZoomEd is reliable, Arcadia is reliable. There's a couple of other brands that we do recommend. I would basically stay away from your super cheap ultraviolet light because it probably doesn't have the spectrum that you need. Okay.
Okay, let's see.
And then I can just answer. I remember there was a question about the cockatiel gender. And I don't know if that person is still on,
Yes,
but
ma'am.
in general, the easiest way to tell, unless you have a full white a Lutino cockatiel, but if you've got any other of the color varieties of cockatiel, if you look at the underside of your cockatiel's tail, and the primary 3 long feathers of the underside of your cockatiel's tail, there will be little stripes of those feathers if you have a female. Okay, so a female cockatiel will have stripes, or we call them bands, on the underside of the feathers of the tail. They may be faint, but they will be present. And to a lesser degree, the males have really, really bright cheek patches and the females have more dull cheek patches. But the main way that you tell is with the bars or the bands on the underside of the tail feathers. Okay.
Can I show you? Is that okay? Just to see if
we can try. I don't know how well it's going to work.
Let's see. I don't know how to turn the camera around. There we go. Okay. Come here, Stevie.
So just looking at the cheeks, I would guess female.
Oh, same here, yeah.
Female. Okay.
But let's see if we can see the tail. Oh, this may be an exercise in frustration here.
Yeah, he's not very friendly with me. He's more addicted to my husband. I guess he chose the person to go.
Will he perch on your husband's finger?
Yeah, can you try to get on a perch? Hold on, let's see. I'm not sure he's wanting to cooperate today. He's not wanting to cooperate. No.
Yeah. So play with them and see if you can get a photograph. And you can also, if you just Google it, you can see examples. There's a lot of examples online of the barring or the stripes on the underside of the tail, so that you can see examples of that and then maybe catch him when he's not quite so freaked out by the camera and see.
Gotcha. Okay. I got you. Thank you.
All right. You're welcome.
Yeah.
Okay, was a question going back to the artificial light. How long should they be? How long should it be on for? And is there distances and things like that as far as?
Right. So that depends on the light bulb, right? Different strengths of light bulb require different distances. So you really need to read the manufacturer's recommendations for how far away that light bulb needs to be from the bird. Certainly, it is the case that if the light bulb is too far away from the bird, that you're not going to get optimum exposure. So it does make a difference how far away the light is from the bird. And in general, I would say no more than 4 hours a day. 2 to 4 hours a day. 2 hours a day is usually enough. But 2 to 4 hours a day is plenty. Okay.
There was a question about how to get rid of the smell in the house from bird poo. There shouldn't be a smell in the house from bird poo, as far as I'm concerned. Yeah.
So that would be cleaning your poo, at least once a day, preferably twice a day. I don't know of any particular products that come to mind.
She's saying it's a strong smell. It sounds like it would be a GI issue going on.
It sounds like you've probably got excess ammonia in your bird's droppings, so that may be a medical concern. If you've got a super duper strong smell to the droppings, I would just, yeah.
I know she's the one that puts the what is it, SCV in the bird's water too for bacteria. We had that question about that. She's saying.
So here's an interesting thing. Okay, if you're treating your bird's water, and then your bird has antibacterial chemicals in the water, that can be killing off some of the bacteria that is normal and helpful for your bird's digestive tract. And if there is a change in the bacteria in your bird's digestive tract, then that could change the odor of the droppings. So in this case, it's interesting that you made that correlation, Wendy, because I do wonder if they might be linked. And it is possible that simply by discontinuing, so number one, I would try discontinuing the water treatment. Number two, I would look at getting a probiotic for your bird. And you can consult with your vet about, which probiotics they recommend. There's a number of them out there, but probiotics in general are safe for birds. And see if, and it's going to take a while. Reestablishing a normal gut biome can take up to 2 or 3 months in some cases. So you're going to have to be patient. But I would be curious to see if the odor changed with, number one, discontinuing the water treatment, and number two, giving it some probiotics and some time, and see if you see a change in the odor. That's really interesting. Yeah.
And plus, wouldn't like going with a more raw food, sprouts and things like that.
Yeah, and obviously making sure that you're on a diet that has lots of prebiotics in it, which is the good, mash or oh my gosh, chop. Yeah, mash or chop diet, that's gonna be really good at getting those bacteria levels back to where they should be. Thank you, Wendy. Yeah.
And then there's go ahead, Lily, go ahead.
She loves dry fruits.
Mm-hmm.
Sorry.
Mm-hmm. Yeah, so do I. But I have a sweet tooth. I can totally relate to your bird. but the fruits are good. Vegetables are better. So so if you can encourage your bird to eat, and they sell, if you're really struggling, they sell freeze-dried mixtures that do have fruits mixed in with the vegetables. That might be an option, or just chopping some dried fruits really finely and mixing them in with some vegetables for your bird to chew on. Depending on, if your bird is a texture junkie or not. That can, different birds, some birds we find really like that soft texture and can play with it, and other birds prefer a crispy texture, in which case I steer them toward the freeze-dried options that are out there. So
what do you mean is there's a lacking of bacteria, good bacteria in her stomach, right?
What?
I'm sorry, you were echoing and I was having a hard time understanding what you said.
Yeah. So what you mean is there's some lacking of good bacteria in her stomach, in her body. I knew this just twice. I stopped because she will not drink the water. So I stopped, no treatment. But this is smell in the house, I open the window every day. I have to put the blanket out, air out every day. I in the newspaper very often, constantly. I stay at home to change it. Once she pooped, I just change it, but still smell in the house. I don't know why.
What kind of a bird do you have?
Blue-headed pioneers.
Oh, and just one? Just one bird?
Yeah.
So depending on, so I would consider having a blood test done on your bird to check your bird's liver function and kidney function, just because there should not be that strong of an odor. Unfortunately, you may be genetically just very sensitive to, different people can smell different things. I don't know if you've ever heard, some people can smell arsenic, other people can't. My husband is a beer judge, and he can't smell certain chemicals in the beer that other judges can, and so they have to pair up judges because genetically we're all different what we can smell. You could just be very sensitive to that smell, but I'm really,
Beautiful.
So,
yeah.
So, your bird dropping should not smell that strongly. And if they are, then I would consider a test, and I would consider looking really closely at the diet and really trying to incorporate a lot of fresh vegetables and sprouts and beans and things like that, and to try to change the digestive tract bacteria of your bird's digestive tract, and that can take a couple of months. Okay.
Yeah, she scratches her all the time.
Yeah, I think it's time for a vet visit. Oh, there she goes. Yeah. Okay.
Thank you. Thank you very much.
Yeah, absolutely. You're welcome.
There's a question, are birds healthier in the outdoor aviary? And is liquid calcium or cuddle bones better?
So, if you are feeding your bird an appropriate diet that contains pellets and contains dark green leafy vegetables, which are high in calcium, you should not require liquid calcium or cuddle bones. Okay. Now, cuddle bones are fun, and I don't have a problem with them from, a point of view of enrichment. But if you are feeding your bird an appropriate diet and providing ultraviolet light in certain cases, then you should not need either liquid calcium or a cuddle bone. And then are birds healthier in the outdoor aviary? I mean, in certain cases, I think yes. If you're in certain parts of the country, they can fly more. They've got exposure to sun, which is really helpful. And I think that once they become accustomed to, seeing what's going on around, they may have more enrichment, watching, the activity of the wild animals around them. So I think that there are definite benefits to outdoor aviaries. Okay.
Can I just add to that really fast?
Mm-hmm.
I'm so sorry to interrupt. I got a really bad storm coming. I'm going to have to shut down here. I just wanted to throw out there that last year I had my gray outside, and we only go out in a travel cage because I live in predator country and supervised. But he got very, very sick, and the vet, I figured out by process of elimination that he had got a caterpillar. So that's just one more thing I wanted to throw out there.
Oh, wow.
By biting the caterpillar, I highly doubt he would have ate it, but he would have bit it and chewed it and then threw it. He got very sick really quick. So that's just something I wanted to bring up.
Thank you. Yeah, that was not on my radar, and now it will be. What an interesting story. Yeah, thank you very much. So, I mean, there are pluses and minuses. There's no perfect situation, right? Because we're taking a bird that's, I mean, birds are not domesticated. We take them from the wild because they are social creatures and they can bond with humans really easily, but they are not a true domesticated pet. And there is, unfortunately, no way to perfectly replicate what they experience in the wild in a home environment. We do the best we can, right?
Right.
So,
well, you worry about the hawks and the foxes while you're sitting outside, but I never even thought I should be worrying about something crawling in there,
I wouldn't have either. Yeah, that's super. That's a great story. Super interesting. I'm sorry that you guys went through that, but I'm glad that you figured it out. So
he recovered. So
yeah, good. Yeah.
Well, thank you for your presentation. I have to check out because it's really lightning out here. So.
All right. Be safe. Thank you.
Bye.
Let's see. I think I covered all the questions. Anybody else have any more questions? Feel free to unmute and go ahead.
I have another question. This is Susan and Gabby, and we're dealing with some air sac issues. They're enlarged, and his last vet exam a couple months ago, he said he has abdominal air sacs that are also enlarged.
Is this an Amazon?
Yeah.
Yeah.
And by the way, he is like loving this he has been with me this whole conference, and he just loves all you ladies.
That's too funny.
Yes. So I read up on it. I was just wondering how concerned that I should be. He does not fly. He was one of the last imports.
Oh, wow.
32
So he's an older bird. Yeah.
He's 32. He just turned 32. And I figure he's 32. So back then it was like clip your bird. That clip your bird. That was kind of the mindset back then.
Yep.
And I did not want him flying around my home. I was able to potty train him. In other words, he tells me when he has to go. He hangs out with me a lot, but he'll let me know. He doesn't potty on me.
Okay.
So I wanted to be able to train him, cut his nails, do some training with him, and you can't train a bird that just flies away. So there was a whole different mindset. Is this because he's not a bird that flies?
So I think certainly that's a contributing factor. Pardon me. Certainly, Amazons as a species are predisposed to air sac blockages and enlarged air sacs. It's an Amazon thing. So part of this is genetic. Okay. it can be very frustrating dealing with these guys whose air sacs don't communicate properly with each other and that have the hyperinflation. And oh, there he is. So getting him to fly will probably help. There's definitely a bellows kind of an action that occurs. And you can start, you can train a bird to fly who has not previously figured out how to fly, even a 32-year-old bird.
Well, I was just wondering because he hasn't developed the muscles.
Yeah, yeah. So it's a process. It's a process. But you can do it. Obviously, you start by having him, on a perch and then lower the perch suddenly, and that will cause him to woo.
Well, you know what? I know what we do. I'll have him flap.
Mm-hmm.
I'll just he'll be on my hand because he's not shoulder trained. I'll have him on my hand and I'll just go up and down so he flaps his wings. So I guess that would be very helpful to continue as well.
Yeah, for sure. So, first thing I would do is I would take away all of his seed, okay, and save the seed just for when you're doing flight training, okay, so that he really looks forward to it, and that's the only time that he gets seed. And then I would, every time that he flaps his wings on the way down, he gets a little sunflower seed, okay, and then you work from there to asking him, you have a perch and you have a perch and they're just a little bit too far for him to step from one to the other, right? And you show him a sunflower seed and you say, come and get it. And he has to just hop. And then you move them the next day you move them a little bit further apart. So he has to hop with a little bit of wing support. And you go from there, just little tiny baby steps. And I would say take away all of his favorite seeds so that he's got a strong reward for doing that. And just gradually, it'll take you a solid month to 6 weeks to train him, but it's doable. It's doable.
Good. Okay. That's good to hear. Thank you.
All right. Hopefully you'll have a at least mildly flying bird for Valentine's Day. Okay. Yeah.
Yeah, my older gray is like that. He used to fly and now he doesn't. So I'm doing the same process. And he happens to be 32 also.
Oh, fun.
Yep. And then
right.
I have the other one who flies all over the place, which I've taught him to fly to me and back. So it is fun.
Yes. All right. Who else has a question? Go ahead.
Yes.
Yep.
It's an Amazon thing.
So I'm.
Oops.
Uh-oh.
Froze.
You froze, Bonnie.
Bonnie, why don't you try typing it instead, because unfortunately your video froze.
All right, I'm muted.
Yes.
What did you want to just tell you? What?
Didn't respond back yet.
And she knows your number?
Bonnie, get in touch with Debbie F. She can
Why
help
are you
me
like
when she
this?
works CPR. I'm looking back through the notes to see.
Oh, yeah, I have to let her back in.
Okay.
She's been having internet things. There you go.
I think I heard some text.
Muted.
Bonnie, you're muted now.
I hit the wrong button. Wendy, I have not had internet issues. Actually, I've just been trying to multitask, which is why I was on 2 devices, then 1, then. Oh
no
my gosh.
worries.
Wendy, you look phenomenal. Oh my gosh, Dr. Nathan, phenomenal. I hope I can see the first pieces because I was teaching at the first bit. Did the woman leave who was talking about her 32-year-old? Is she still here?
She left.
She left. Okay. All right. I hope somebody.
Who, me? Are you talking about me?
I
The
think
Amazon?
so.
Oh,
Yeah.
there she is.
Okay. So I'm just gonna tell you real quick that I have a cockatiel, and I am on the high end of the autism spectrum. And when he came home, and he was very quiet, and then he started making a lot of noise. And a lot of people said to me, he's a bird, he's going to make noise, and all this is on you. People said, cover him, yada, yada, yada. A friend said, go on to the Phoenix Landing lecture that Debbie was on. I didn't know Debbie from a hole in the wall. And she taught the ABCs, and at the end, she said, what are you going to do? And it was webinar. Nobody could see one. And I said, contact you. And I wrote to her and I said, look, all these people are saying he's a bird. It's me. It's my issue. And I contacted her and I wrote and I said, this is what my story is. I know he's a bird and I'm a person who's on the spectrum and I want to love him and take care of him. We met and all in March of 2021 and all. I've been working with her all this time. A bird can be taught anything at any point in their life because what she taught me is that he's going to make noise, but she taught me I have to reinforce the quieter behaviors. Mm-hmm. And I hate when I see stuff, and I'm such a fan of Wendy's because I took the nourishment course, and Wendy worked with me probably 15 emails for me to understand what I was supposed to do. And thank you for what you guys do. Mm-hmm. And
amen.
It's all about birds.
Amen.
All about
it.
Wendy is a godsend.
Well, certainly you too.
Thank you.
Yes, perfect. Well, it was a phenomenal class. I mean, are there any other questions? Because otherwise we're gonna just thank you for your time, or if you have more comments or whatever, and we can just, like I said, our next food workshop is third weekend in February. There's a kit that you can get, and I'll have all that information later on the signup.com. But oh, Dr. Laura, I was wondering, I don't want to put you on the spot, but you said that that would it be possible? I mean, in the emergency care class.
Oh, yeah, I have. I mean, I've taught first aid for other species before. I will share with you, though, that I repeat myself a lot in the other first aid classes that I have taught, like first aid for rabbits and first aid for other species, because unfortunately there are limits.
Mm-hmm, true.
To what you can do at home, and I will admit that as a veterinarian, I have a tendency to assume maybe a little too much medical knowledge in the care in my client's background sometimes. I forget that, a client knows as much about medicine as I know about, car maintenance, so sometimes I assume too much and ask a little much of my clients that way. Yes, I'm happy to teach a class. It would unfortunately not be a long class because there's certainly a limit to what you can do as. And even some of the things like subcutaneous fluids, in a rabbit class or a dog and cat class, we teach how to do subcutaneous fluids to these pets. Mm-hmm. But you can't do that safely to a bird. There's a very specific technique and things can go very wrong. So unfortunately, first aid for birds is more limited in a lot of ways than it is for cats and dogs. I'd be open to it, but it would not be a long, involved class.
So basically, we covered a lot of that.
Yeah. Yeah. Are there any other specific first aid situations that you're thinking of?
No, you just said that there was, because I think we've covered them as far as the big ones are the cloaca prolapse, the egg laying, the blood feathers, the bird at the bottom of the cage.
Yeah.
I took many years ago, like 2010, did a bird first aid course, and they actually taught like beak to like CPR. I mean, your chances of being successful aren't very good, but they taught beak to mouth, and stuff. And I would love, even if it's short, you know, having like more information of how to do certain things. Like,
yeah. I mean, that would definitely be a section that we could add into a bird first aid course.
Okay, well, maybe.
It is doable, but it's not, again, not highly likely to be successful. You know, most of the time, if you've got a respiratory emergency in a bird, it's either Teflon, in which case their lungs are full of fluid and you can do all the CPR you want and it's not going to make any difference, unfortunately. Or, you know, it's heart disease or primary lung disease. Yeah, I mean, we can teach it.
Well, we can marinate on this.
We'll marinate on it.
Yeah. Deb had one question, and it's about covering and not covering. I mean, I always teach that if you clean at night, you can cover it at night, but it's not necessary to cover your birds. I mean, what's your opinion on this?
My opinion is that birds deserve a quiet, dark place to sleep.
Yes.
And if you cannot provide a dark place to sleep by putting them in a dark room and turning out the lights and having it be dark enough, then you should cover your bird. And I recommend that you go to the store and you buy a room darkening drapery, like window drape, that is specifically says that it is a room darkening drape, and use that to cover your bird. But if you have, you know, what I usually recommend is that you have a small nighttime cage for your bird that is, you know, it can be just big enough for your bird to sit on a perch comfortably. It doesn't have to be anything big. And you take that and you put it in your guest bedroom or wherever you have a place that is unused at night, quiet at night, and dark at night, then that's perfectly fine. You don't need to cover your bird. But, and then your bird comes out of that cage and spends the rest of the day in the day cage, which is, you know, bigger and hopefully all over your house. So that's, I guess, my ideal, but if that's not possible, then cover your bird.
Yeah, that's what I teach is the sleep cage. If your bird's in the central location of your house, you have to have a sleep cage. Yeah. So, okay. Perfect. Okay, anything else before we depart of this? I so appreciate your time. Diane, you had something?
I have a rescue. He's a hybrid of Nande and Sunconure. And I was curious, he keeps obsessively regurgitating his food. He's not with another bird, he's by himself, and he continues to regurgitate his food. And I'm not sure why. I mean, he's healthy, he eats good, he drinks.
His stools are normal?
Yeah, everything's perfect.
Okay. And he's obviously not doing it for sexual reasons if he's by himself and he's just hanging out in his cage and regurgitating.
Yeah.
Certain times of day?
All day, any time of the day. Matter of fact, I have to clean his cage almost daily because he
splatters it.
Then.
Yeah, he's splattering it everywhere. So, I mean, it's possible that he could have an esophageal stricture. Okay, so you remember that there's a food tube that goes from the mouth to the crop.
Mm-hmm.
And then there's a food tube that goes from the crop to the stomach, to the first stomach, the proventriculus, right? So it's possible that he could have a stricture in that esophagus area between his crop and his proventriculus that makes food, makes it difficult for food to pass, and that he may just have chronic crop enlargement. So, I mean, if that were the case, if there was a stricture, then I would expect that his crop would be larger than normal. And you're saying no?
Yeah.
Okay.
Would an X-ray show anything in that? I mean, being soft tissue?
So you would need to do something called a barium series. You would need to do an X-ray, but you would need to give him oral barium before you took the X-ray in order to see that area. And you might get lucky, and you might not. But I definitely think that that a barium series would be the first logical step if you were trying to you're trying to eliminate a medical cause for this. Of course, birds in captive situations, especially with not a great start to life, can be a little bit cuckoo sometimes, and sometimes they can develop some pretty weird obsessive compulsive behaviors, and birds can, you know, develop. And I watched a video talking about another destructive behavior in birds. And they were postulating that that's not a true obsessive compulsive behavior, but there are they did mention other true obsessive compulsive behaviors that birds can engage in. And it's possible that you may be dealing with something along those lines, in which case it may be a question of trying to, instead of look at it from a medical point of view, you look at it from a training point of view, and seeing if there's other behaviors that you can get him to engage in. If you can figure out what the signal is just before he regurgitates, if you can watch him closely enough, maybe video him, maybe set a camera on him so that you can just see it over and over again, see if there's some behavior that he does just before he regurgitates, and then try to redirect him to some other behavior just before the regurgitation. That might be an option if it's behavioral, which, you know, at this point, it could be medical, it could be behavioral. I'm afraid I just can't say. So, and I assume you've tried like apple cider vinegar in the water.
Yeah.
Yeah. Okay. Yeah. I'm sorry I don't have an easy answer.
Yeah. No. Just redirect his habits, or redirect him into another focus point, or something like that.
Yeah, yeah. If there's something you can get him to do with his mouth, do with his beak, you know, as a substitute behavior. Yeah.
Okay, great.
Sorry, I don't have an easy answer for you.
No, that's okay. Thank you.
Yeah. Just try to, yeah, I love that. If you want to change a behavior, you have to insert a new one.
Yeah, yeah. And you got to figure out what the antecedent is, right?
Exactly. Yeah. It's all about training. Yeah. Very good. Okay. Are there any more questions? Go ahead, Bonnie.
Sorry, I have 2 questions. Hopefully they're short. One is, you said not to do kissing, and I do not I kiss like the top of his head.
Mhm.
Is that once in a while he'll try to kiss me and like I nip it in the bud.
Mhm, mhm.
Is it okay to be kissing the top of his head?
So, from a sanitary point of view, you know, you could still potentially theoretically get something if your bird had a contagious disease from the top of his head. But if you think about one bird preening the pin feathers off of another bird's, I mean, the head is where they do the preening, right? And they do it with their mouth. So as far as behaviorally sending the wrong sexual signal to your bird, that's fine. You can kiss the top of your bird's head because basically that's the only way that another bird is going to take care of pin feathers on the head is with their beak. So that's fine.
Okay, the second question loaded. He is not a flyer.
Okay.
When he takes off, he gets a significant distance. Not that he wouldn't take off if he got out. I understand that clipping. He has, I think Wendy's seen it. He has 2 gyms in the room, a cage, and a file cabinet that he's out most of the time. Is that basically as long as he's walking and moving and doing like that type of stuff, he's getting cardiac health still? Or is it kind of like, really? That's why loaded question.
Yeah, so I would love to tell you that leg exercise is enough, but from a purely biological point of view, there is no substitution for flight. It really, I mean, and here's the problem, right? If we were talking about a ground-dwelling bird, if we were talking about a chicken or a duck or a goose or, you know, any of the birds that, or a brown thrasher, any of the birds, roadrunner, that typically spend their time on the ground, those birds biologically have evolved that that's going to be their main exercise. Cockatiels, no, they're strong flyers in the wild, and that's their main workout is flying.
He gets a little flight feather and he's at the other end of the house. And I've spoken to Debbie about it, and I said, it's not, like, I don't know how to make a safe environment for him because he goes a significant distance, like inside the house.
So it is, so this is not something that I would have said to the whole group, but in a small group, I will tell you that you may want to consider trimming his feathers a little bit. So instead of removing an entire primary feather, you may want to consider taking off, you know, the bottom inch.
I think that's what it is.
You know, of the first 3 feathers. And you have to do it carefully because you don't want there to be any little, you have to use really good cutting scissors or whatever you're using. I use nail clippers typically, or suture scissors is what I use, because you don't want there to be any little spicules or fragments. You don't want to split the remaining rachis, but you can trim off just a little tiny bit of the bottom edge of the feather, and that might make it so he could fly, but just not long distances.
There's a method. It's Todd Drager's. Have you heard of him?
Yeah, and I wrote it down of how to do it.
Oh, how to do the feather stripping? Is that what you're talking about, Wendy?
The Drager method, yeah.
Yeah, doing the feather stripping. That's tricky, though.
Yeah, he does that with one hand. He goes up, he leaves a little bit at the end, and then goes along the shaft.
Goes along the, yeah. Mm-hmm.
Yeah.
People tell me that I'm abusing him because I've had his, and I'm like, I don't think so.
I'll see if I can find the link for him and I'll send it to you. If you can find someone who can cut like that, because that way they still get some lift and flight, they have to work so much harder to get there. And so it seems like it would be great cardiovascular, and they're not all over the place.
Right. Okay.
I've seen that technique, but Wendy, can you tell me, because honestly, when I've seen it, I've been like, that's going to take way too much time and effort, and it's going to stress the birds out, and I need something that's
quicker and easier.
Yeah. But honestly, maybe it's time I revisit that. Can you tell me the name of the?
He's Todd Driggers, Driggers. And I think he has stuff on Lefebvre.vet on it.
Yeah.
Hey,
I love Lefebvre's website. Yep. They are fabulous. Yeah.
Wendy, that I think was the only lecture that I've ever taken with you guys that I actually went. It wasn't you guys; it was Phoenix Planning that I went off early, because as he was speaking that if you do clipping, like, you are really hurting the bird, like really, like I called Debbie and said, am I like really screwing up here? And all after that was the only lecture I've ever left early, because I completely understand the concept, and I've spoken to Debbie every single time and said, I want to allow him the opportunity. And she said, when you're talking about clipping, you also have to talk about safety.
Exactly.
It's not just, I just don't want him to fly. Is it safe for him?
Mm-hmm. Those are the special considerations there. I mean, but if you can, or just clip a little bit, just to slow him down to where he can fly, but they can't get the huge distance. Or if you have a hallway that you can just train him to down and back, for 20 minutes you go fly him in the house.
Mm-hmm.
You know how we are after 20 minutes of running or whatever, we're like, but yeah, it doesn't have to be all day long, but it can be a specific flying exercise that you want to do with him, I guess.
Yeah. Mm-hmm. And I love the videos that you guys do for CPR. And
we try. We're trying to keep things abreast of, because I know this changes a lot as far as avian health and wellness and food and everything. So, yeah. Okay, are there any more questions before we? Jason, are you still here? I see you've got a hand up. I don't know if it's a question for me or a question for Dr. Laura. If there's any questions for me, you can just email me at education@companionparrots.org, and I can take care of that later. But are we all good?
Can I ask one more quick question? Are you gonna kill me?
No.
When there's times where he'll touch up against something or whatever, and he starts going like this, and I know something is like hurting him. He'll be adjusting his wing, and clearly something's bothering him. Is there anything I can do in that moment, to help him, or not really?
I mean, you can feel around the area. I mean, it's probably his shoulder. It could be, sometimes it's something as simple as they got two of their primary feathers crossed over each other, and they're just trying to like adjust to get them uncrossed, if you see him, and this is different behavior than him just taking that wing and just stretching it out, right?
Absolutely.
Okay. Yeah. I mean, you certainly, the first thing I would do in a situation like that would be to feel around the shoulder. I don't know if you can see what I'm doing. Feel around that shoulder really carefully and see if I can find a place where he says, and I'm being very precise, and I'm just, sort of doing this kind of a thing to try to check and see. I don't know if you can see what I'm doing with my fingers there, but that allows you to find the sensitive area, right? And then see if there's anything going on there that might
Okay.
that that might be bothering him.
I'm muting. No more questions. Thank you.
Okay. All right.
Jason has a question. Jason, you want to unmute and ask?
Yeah.
Okay, go ahead. Yeah.
Hello? Hello?
Hello.
Hi,
Yeah.
we can hear you.
Oh, good. I owned an umbrella cockatoo since he was 5 months old. He's gone now because of personal, I don't want to get into it, but I like to know, I have always taken him out of the cage. I'd put him on the top of the cage. He would never want to fly. I'd always carry him around. I'd carry him upside down in my hands like a baby. And it's like he didn't even have the effort to move his wings around. And I have always, opened up his wings and checking it, each wing, to see if there was any problems. And he never, bothered to bite me or anything. Like I wasn't hurting him. So was it something that I have done since he was a little baby? I used to feed him with a syringe, every day, 3 times a day. I used to take him up into my bedroom and he'd lay down in bed with me and climb under the covers and cuddle in my armpits. But why didn't he want to fly?
So first of all, you have to realize that probably of all of the species of birds, certainly all the common species of pet birds, cockatoos are number one, and specifically umbrella cockatoos, I would say, are number one for being the most touch-oriented, cuddly, truly, we call them Velcro birds, right? Because they just want to be in contact with their mate or their human, like all the time. And I do think that it sounds like you probably had a mate relationship with your bird rather than a flock compatriot relationship with your bird. And so that probably contributed to it. Because, a lot of times these birds